Gano, Sago, everyone. Welcome to your midweek Wednesday podcast, once again for May 20th, 2020. For those of you just joining us, please allow me to introduce myself. I'm Lori Davis Hill, Director of Health Services and Incident Command during the course of the pandemic as part of the declared state of emergency for Six Nations of the Grand River. And this is your COVID-19 update. Let's begin with a visit to our wellness section. We have had the pleasure of visiting and receiving wellness information from this guest before, so let's welcome back one more time Community Crisis Response Coordinator Natachia Slezsak. Natasha, it's always a pleasure to hear from you. I know this pandemic is playing on our mindsets. We have heard that the province has decided to keep kids out of school for the rest of this school year, not to mention our kids are seeing the weather go from spring to hot. I'm sure this is making us all a little bit anxious about how to carry on our typical activities. Can you share a little bit about mental health in children during these challenging times?
Hello, everyone, and thank you, Lori, for having me back on the podcast today. I was hoping to be able to speak to you all today about how to support your kids' mental health during the COVID-19 pandemic. A few tips I have to share with you are to be mindful of what your child sees or hears on the television, radio, or online. Too much information or consistently following updates about the status of COVID-19 can increase anxiety. Be aware that information intended for adults can cause anxiety or confusion, especially in young children. Manage your own anxiety. If you are feeling anxious, take some time to manage your fears and take a few breaths before starting a conversation or answering your child's questions. Help your child sort through the information on the internet. Some information, stories, social media posts may be misleading or based on inaccurate information. Take time to look through the information together and take time to answer questions. Maintain your structures and routines. Structured days with regular meal times and bedtimes are an essential part of keeping kids healthy and happy. Planning daily walks can be a good way to create structure and ensure physical activity. Children tend to do better when their activities are planned, and therefore, whenever possible, inform them about any change in routine ahead of time. Know that your children and teens often worry more about family members and friends than themselves. For example, if a child hears that an older person is more likely to be seriously ill, they may worry about their grandparents. Letting them video chat or call with older relatives can help them feel reassured about loved ones. Help your child feel in control whenever possible. Kids feel empowered when they know what they're to do to keep themselves safe. Take any opportunity to let your child feel in control by making choices or taking steps to keep them healthy. Teach kids that staying healthy and having good hygiene habits can help them stay strong and well. Explain that regular hand washing also helps stop viruses from spreading to others. Although you want to help your child feel in control, it is also necessary to set limits. For example, you may encourage structured or unstructured time, as well as supervised and unsupervised time as appropriate. Be a good role model for your children. Children learn the most from what they see their parents do, and therefore setting a good example and taking care of your physical and mental health is a good way to help ensure that you are being a good role model. If your child is overly focused on negative thoughts or outcomes, help them think in a more optimistic way. For example, letting them know that just because there's a risk that something will happen doesn't necessarily mean it will. If you or anyone you know may be having difficulty coping, please reach out to any one of our services. We have our mental health and addictions team. Their contact information is 519-445-2143. We also have our Six Nations Social Services, 519-445-2071. We also have Gunakwasha Family Assault Support Services. Their 24/7 support line is 519-445-4324. And we also have our Six Nations Mobile Crisis Line, which is available 24/7. Text and live chat is now available during business hours. Their number is 519-445-2204 or toll free at 1-866-445-2204. Thank you again for having me on the podcast. Everybody have a great day and stay well.
Thanks a lot, Natasha.
Oh.
We'll see you back next week. Yesterday, the province noted that there was a spike of 427 new cases of COVID-19 and questioned if it is directly related to people not practicing physical distancing. Let's see how that translates here and in surrounding communities. At Six Nations, our active case count this day is 0 cases. Overall, to date, we've reported 11 cases. 10 of those cases have resolved with 1 death. We have administered 602 tests, resulting in 516 negative results. 56 people have been currently directed to self-isolation by Michigan Public Health. Please continue to identify symptoms and get testing to help us monitor the impact of the virus on Six Nations. Now to our surrounding communities. Mississaugas of the Credit First Nation remain at 1 positive case reported. Alderman Norfolk Public Health Unit, 207 positive cases, 87 resolved, and 31 deaths. Grant Public Health Unit reporting 103 positive cases, 93 resolved, and 3 deaths. Hamilton Public Health Unit reporting 599 cases, 394 resolved, and 27 deaths. And the Toronto Public Health Unit reports 8,866 positive cases, 6,616 resolved, and 690 deaths. Phase 1 of opening up the provincial economy has begun. Parks, one-on-one sports with no spectators may now begin to open if public health regulations are followed. Very few public washrooms are open for use. If you find yourself at one of these type of settings, remember to wash your hands thoroughly for 20 seconds or use hand sanitizer. Practice good hand hygiene. Maintain the 6-foot physical distancing. And if you cannot, wear a fabric mask. Let's stay COVID clear. If you are experiencing any one of the COVID-19 symptoms or any other new or unusual symptom, it is very important that you call the Six Nations COVID-19 Assessment Center at 226-446-9909 or toll free at 1-855-977-7737. The COVID-19 hotline is open 7 days a week to take your calls. The warm weather is here, and as summer begins, remember these until tomorrow's podcast. A Six Nations COVID-19 relief fund has been announced, which will be used to purchase much-needed personal protective equipment, medical supplies, including equipment to maintain essential pandemic operations, as well as food and necessities for many community members who are facing financial challenges. The fund is being administered by the Royal Bank of Canada, and contributions can be made through electronic funds transfer at covidrelief@sixnations.ca. Public Works has put out a call for homemade masks, and all donations are greatly appreciated. For more information, please call 519-445-4242. If you would like to connect with the Six Nations Mobile Crisis Service, you can contact them by text Monday to Friday at 226-777-9480 or by live chat on the Six Nations COVID-19.ca website. Yesterday, we mentioned that May 19th was Personal Support Workers Day. If you did not have a chance yet, please take a look at our social media feeds for our recognition posts, along with the National Nursing Week recognition as well. We would also like to say thank you to our local family doctors, as yesterday was World Family Doctor Day. Six Nations appreciates each one of you working to keep us healthy. Remember the good mind for all of our frontline workers here on Six Nations and around the world. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Nyawa.